filtering of that evidence, a filtering of that proof in this hard science. It can never be proven. I don't believe anyone until they convince me kind of thing. And I just don't think that's very useful. And you'll hear in a minute that Dr. Long doesn't quite agree with me, and that's okay too. But the second way in which these experiments with Uri Geller relate back to my interview with Sam Parnia and my interview with Jeff Long today, and with the feedback that I received from so many of you, because some of that feedback was along the lines of, hey, Alex, give him a break. He's really on our side. He's just saying something different because he's in a tough political spot. So the idea was, hey, there's a little secret here, and Sam Parnia is really an NDE proponent. He just says all these really skeptical things because he has to do that in order to advance his career or to fit in or to be accepted in his community of physicians. And I'm not denying that there's some truth to that, and you'll hear Jeff Long kind of say the same thing. I'm just saying I don't want to go there. I don't want to accept that we have to take what someone says and interpret it as meaning the exact opposite of what they said in order to make it fit into some contrived system that we've created. Because that's what we're really saying, right? We're saying, hey, the medical, the academic system of proof, of knowledge, of what's real is so confined by this paradigm of materialism that we have to dance around it, and that we have to accept that maybe folks who are trying to challenge that are really going to say something different than what they really mean, because we know there's so much pressure, even though that system isn't real and is being assailed from so many different directions. We have to just kind of ride along with it. Well, no, we don't. I think the only thing we can do is evaluate Sam Parnia, Uri Geller, and the people that oppose them by what they really say and what they really do and what we can really prove. So with that as an introduction, let's go to my interview with Dr. Jeff Long. And let me also let you know that I want you to stick around after the interview, because I want to read to you an email that Jeff sent me that really, I think, fine-tunes what he's saying or puts it in a different light, actually quite a different light. So stick around for that after this interview with Jeff Long. Dr. Jeff Long is one of the world's leading NDE researchers. He's a medical doctor and the author of the New York Times best-selling Evidence of the Afterlife. So Jeff was nice enough to jump on the phone here with me and talk a little bit about the interview that I recently did with Dr. Sam Parnia. Jeff, I sent you a copy of that interview, and I know from the email you sent me back that you respect Dr. Parnia. You've been on a couple of panel discussions with him. So what do you think of this "I suspect NDEs are an illusion" comment from Dr. Sam Parnia?
Well, actually, Alex, when I read the interview, it sounded to be more like Dr. Sam Parnia considered NDEs to be a research question. In other words, that's why he's doing his prospective study. A comment that stuck out more to me is, quote, "I don't know," unquote, in terms of what the cause of near-death experiences are. I don't know to the point that it's valuable and worth doing these kinds of prospective studies to help be sure, or at least gain evidence in one direction or the other as to what the cause of NDEs is. And I think that's very reasonable.
You know, Jeff, one of the reasons I really like and appreciate the way you present this information is it's really straightforward. I know where you're coming from because you're direct. Now, one of the problems I've had with Dr. Parnia is he kind of is all over the place. I mean, he says that maybe it is, he says maybe it isn't, we have to investigate it. And I have to kind of take a little bit of exception with what you're saying. I really pushed him on this issue because in his video presentation, he went a lot further than being neutral. I mean, I'm all for a guy saying I'm neutral, I don't know where it is. But no one forced him to say, after his 12 years of research, reviewing 500 cases in his file, that he suspects that they're an illusion, a trick of the mind. I mean, I think we have to take him for his word here when he says he suspects they're an illusion. I don't know how he can come to that conclusion.
Well, I can tell you, first of all, I certainly strongly support anybody to have any reasonable opinion about near-death experiences. I think the one opinion that I think is not reasonable at this point in time is the absolute blanket statement that NDEs are illusions. There's just too strong evidence that's been forthcoming from my research as well as the research of others. I mean, by the time you have near-death experiencers with crystal clear consciousness, the out-of-body observations seem to overwhelmingly be correct in both prospective and retrospective studies. Near-death experiences and those totally blind from birth, typical near-death experiences, even while under general anesthesia, and it goes on and on. I think given the strength of that evidence, I would take strong issue with someone that was an opinion that said NDEs are definitely an illusion. I think that's really pretty thoroughly refuted. However, if people are uncertain about whether near-death experiences are an illusion or not, in other words, they're open to the possibility that NDEs are real, I think based on the evidence, and certainly based on what an awful lot of informed, very reasonable people, scientists, physicians today believe, I think that is a reasonable position. And I see Sam Parnia's beliefs as being in that, what I would consider the area of being a reasonable opinion. And that's why there's research. I think that's doubly true for Dr. Parnia, given the fact that he's doing the world's largest prospective study on near-death experience. I mean, if he's going to do that, I think especially in his role as principal investigator, he really needs to have that credibility, I think, with institutions he wants to work with to say, hey, this is a valid question. We don't absolutely know the answer one way or the other, and that's why we're doing research. That's why we're doing the study, so that we can learn something to help answer the question. So I think especially for Dr. Parnia, it's certainly his point of view is certainly reasonable given his role.
Okay, I mean, I think that's valuable to get your input, Jeff. I appreciate it, and I appreciate the fact that you've vetted him a little bit and think he's a competent guy. I know he's a competent guy, but you think that he's a good guy. I'm still not convinced because, the other part that doesn't really add up is, it doesn't add up to me that somebody who's researched it that long and still suspects it's an illusion. I just don't know how you come to that conclusion, but I'll defer to what you said, that that's in the realm of what someone could reasonably kind of come up with. But when we take that and follow that through with how he's done this research and some of the statements he's made that suggest that this is the definitive research, this is the way to do it, in terms of putting these images on the ceiling, and then when he says that we're going to get hundreds of people to see these images, and when you press him on a little bit, you say, just look at the cases out there, how it just doesn't add up that unless you did thousands and thousands of NDE accounts, that you would get hundreds of people seeing those pictures. It just starts adding up that, maybe the guy is coming at it predisposed to really, really disprove the validity of the NDE experience.
Yeah, and I've spent a lot of time talking with Dr. Parnia, and I really don't get that at all, Alex. The sense I get is that he very much believes in his research study. I know him to have a great deal of honesty and integrity. He's going to report the results that he gets with this research study. I have no doubt about that, and exactly what the facts of the finding of this study are. Good gosh, you've got a guy here who's going through a fellow Yale University, something who's got almost no discretionary time in his life, and yet he has the dedication to carry forward one of the largest prospective studies of near-death experience ever done. I'm just in awe that he has that kind of dedication, puts that much time into it when he's got so little time in his modern life, and is still going forward with his study. From my point of view, I think we really need to respect anybody that is doing research on that, regardless of what their opinion is about the cause of near-death experience, because it's the findings from the research that are really going to help us understand near-death experience in the future. I mean, I believe, from all I know about near-death experience, that's going to help others be more convinced for the reality of near-death experience. But again, we'll let the research do the talking when it matures.